Queer healthcare from Blue Shield of California. Hello, I am Kevin Canals, an independent health insurance agent in California and also a certified Covered California agent. Blue Shield has announced that they are collaborating with FOLX, who is a virtual primary care provider, to cover the membership fees of their PPO subscribers into the FOLX program so LGBTQ people can access the full suite of services from FOLX. So what is FOLX? FOLX is an online virtual care primary care provider that offers a variety of services that are, I wouldn't necessarily say tailored, but are friendly to LGBTQ people. That's the way it's kind of set up. And they do cover a variety of different, healthcare topics, anxiety, depression, wellness exams, treatment of other illnesses, the management of chronic diseases, thyroid, diabetes, high blood pressure. Of course, they are also involved with gender-affirming hormone therapy and support for mental health conditions surrounding the transition, gender dysphoria. You can get help with sexual and reproductive health, fertility and family planning. So there's a lot that's going on at FOLX, which is kind of like a medical group to a certain extent, and you can use them as your primary care physician. What I find interesting about the FOLX healthcare model is that they are also a patient advocate and a concierge service. And those are two aspects within our healthcare system that are missing, that are lacking, because oftentimes people are kind of on their own out there in the world, especially if you're in the LGBTQ community and facing certain issues. It's hard to find advocates, people to help guide you and counsel you and stand up for, what you need in healthcare services. And it can be difficult to find someone to refer you to people that aren't going to give you that sideways glance, like, who are you? Why is your hair like that? So I really like that. FOLX talks about vetting the specialists that they refer people to, because let's face it, not everything can be taken care of with a virtual office visit. Sometimes you need to go see a dermatologist for that spot. Is it skin cancer? Do I have to have it removed? And that's going to need to be seen by a dermatologist, in person, and then, potentially make the treatment, which I seem to have had plenty of sitting out in the sun. FOLX, they state that 81% of their team identifies as LGBTQ+. And so that's where they're centered. And you know that when you contact them, again, it's going to be friendly and welcoming, no judgment, and you can feel safe and secure. FOLX does work to provide letters for gender-affirming surgeries, because as some people know, the process to get gender-affirming surgeries approved through health insurance like Blue Shield, it's a multi-step process. There are letters, testaments about the health condition, the gender dysphoria, and there's a lot of background work that needs to be done before a health plan like Blue Shield can approve the surgery. So they will work with folks to make that happen. FOLX is also prescribed medications, and they do have kind of like a pharmacy delivery system where they can deliver things to the door. They can also send the script to your local pharmacy so that you can pick up the prescription. And that's something you'll need to, look at and investigate. If you have them deliver it, can you run the prescription costs through your health insurance? Because that can be very important, especially if you have health insurance, and it can really drastically reduce the cost of the prescriptions when it's run through the health plan. Of course, depending on the state and whether you have health insurance, not everyone covers, hormone replacement therapy. FOLX has set up a care fund that people can donate to, and the care fund provides financial assistance for gender-affirming hormone therapy, including prescriptions, clinical visits, and labs. So this could be very, very important for many people that don't have access in terms of the funds to cover these visits and the prescription medications if their insurance doesn't cover it, or they just don't have insurance at all. So how does it work with Blue Shield and getting them to cover your membership fee? So first, you need to enroll in FOLX, and I believe it's about $39.95 a month or something. And then you can book a visit and get your prescription medications. They also have a community platform, message center, a library with additional information. But once you've enrolled, how do you get reimbursed for the monthly membership fee? Now, there's a whole page on their website, and essentially what you're going to have to do is you're going to have to submit a claim to Blue Shield, and they're going to have to send you a check. Now, this is really kind of backwards in today's online electronic funds transfer, but that's the way it's working for now, and that's okay. Now, one of the reasons that's on a monthly reimbursement is that health insurance is monthly, and it's possible that you may not have Blue Shield PPO next month, and that's why I suspect you cannot do an annual payment and be reimbursed for the annual payment to FOLX, because then if you're not with the plan, that's going to be additional bookkeeping, and it's just not going to work. Another hurdle for the reimbursement is if the health plan is maybe the primary applicant is one of your parents. And they state that the reimbursement check will be sent to the primary applicant. So if you are not the primary applicant on the Blue Shield PPO plan through Cover California or direct with Blue Shield, maybe it's an employer plan, that check's going to be sent to the home address of the primary applicant, and maybe you do not want mom or dad or somebody else to know you are using FOLX as your primary care provider. So FOLX says that they're working with Blue Shield to find alternative methods for reimbursement. I'm not sure. If I hear of anything, I will post that in the blog post, because this blog post will be on my website with additional information. And here is the FOLX website, so you can go and see for yourself if this is something that you want to be involved with for them as a primary care provider, and for Blue Shield to reimburse you for the membership fees. And FOLX works with a lot of other health insurance companies. You can see Cigna and some of the others there, and you can get into the FOLX website and then look at the different insurance plans that they cover. And you can see here, this is just a snippet of the page, Blue Shield of California, and I've highlighted that Blue Shield of California is covering your monthly membership fee. Learn more here. So some of the health plans, just not Blue Shield, will cover the monthly membership fee, so that FOLX can be your primary care provider, and those costs will run through the insurance, because it's all going to depend on the benefit structure of your health plan. So if you have a health plan, say a bronze plan, and the primary care office visits are $60 a month, when you have an appointment with a FOLX clinician, it's going to be billed as a primary care visit at $60. Okay, so you need to pay that, but it's going to be run through the insurance. If the primary care visit is $35, that will be your copay. For the prescriptions, your cost sharing will be embedded within the benefits. So if generics are, $10, that's what you're going to pay for generic costs if they prescribe and you pick them up at your local pharmacy. So it's all running through the health insurance, and being a member of FOLX gives you access to the clinicians, and you can lean on them as a primary care provider and talk with them a variety of different things. It may not be LGBTQ related. It may be dermatology related for skin cancer because of this beautiful California sun that we have. So if you have any questions or comments, you may leave those down below and I'll do my best to answer them. You can go to the FOLX website and learn more there. And there may be some links within Blue Shield of California as well. Otherwise, for InsureMeKevin.com, I'm Kevin Knaus.